Okay, good afternoon. Myself, Professor Dr. R. Deshpande, would like to welcome you all on this class of Charak Uttarardha that is taking place on the 8th of October 2023. And from 3 to 4, the class timing is. And we will start. This is the first lecture of the Charak Uttarardha. Of course, as you know that I am teaching you 5 subjects altogether. First is, of course, the Monday, Roga Nidan or Roga Vijnan, Vikriti Vijnan. On the Tuesday, there is a Prasuti Tantra and Stri Roga. Then Wednesday, we take always in the evening, for example, 7 to 8 that we are taking. That is a Kaumar Bhritya Tantra or Balrog, or it is also called as Ayurvedic Pediatrics. On the Sunday, we are trying in the morning from 11 to 12, or sorry, 11:15 to 12:15, that is Swastha Vritta. And now, in the afternoon, Sunday, we are talking about Charaka Samhita Uttarardha. I think you might have been heard the phrase. I always ask the students to make a separate notebook for each and every subject. So 5 subjects, 5 notebooks. Maybe that notebooks may be finished, and then you have to prepare a second notebook of Roga Vijnan, then maybe second notebook of Swastha Vritta, etc. But this is your first notebook. Okay, fine. I think I don't know, but student has gone off. That Ankit is not there. Okay. Yes, he had joined. Ankit, you have joined once again. So, okay. I will see what we can do. Just a moment, because my video has again gone off. So, okay. Yes, it is there. That is fine. So, my dear friend, I was talking to you regarding the Charak Uttarardha, and I was discussing that you can prepare the separate notebook. And in that notebook, always prepare some index. That is the date you have to write. So, for example, first, serial number first, today's date is 8th of October. Then you have to write down the time also for example, 3 to 4. Then write down the Charaka Uttarardha. First, we will discuss about the question papers, past question papers. In the morning, I told you that in any subject, when you want to study, as per the guidance of Professor Dr. Rajendra Deshpande, I suggested that when we think of question papers, that should be our basic ideas in our mind, that when I attend my college lectures, when I attend my Professor Deshpande's lecture, or when I read my own purchased textbook, there I always telling you that go on making a pages 1, 2, 3, 4 till the last page. And when you make the movements of these pages, always a surfing, you should do the surfing and see the titles of the para and all these things. Oh, okay, this point that I heard in the with the Dr. Deshpande, that it was in the question paper. Okay, make it a tick mark, make it IMP, because then in the textbook you will different pages you will make some important things which were asked in the past question papers. Now, in this period, I am making you one more suggestion. First suggestion, that you have to go through the textbook from first page to the last page, just making a surfing, overlooking, superficial looking, I can say, and making the tick marks as you remember the question papers. Next thing, now I am telling you, for any subject, whichever the book that you have purchased, no matter whatever it may be, textbook, own, but not of the college library, own purchase textbook, at least one textbook should be there. Then you always make a habit to read the index. Please listen carefully. Read always index of any textbook. Then that will make your more and more confidence. Oh, okay, this terminology I have read in the index. This terminology, this word, this phrase, this topic. So always you should be aware, okay, this is important, then that study will be very fast and very perfect. That's why no teacher thinks of the question paper first. They always criticize the students. Oh, you first study hard. You first study whole syllabus, then think of question papers. No. Dr. Deshpande has another very important and experienced policy. The students definitely get benefited. if they check the question papers at the beginning and every now and then, every time, always have a look on the question papers. So Charak Uttarardha question papers, just without wasting much time, summer 2022. Now, in Charak Uttarardha, you have the three important, what you can say, sthana. You write down this word in the notebook. Some keywords. Dr. Deshpande always telling some keywords. Which sthanas are there in Charak Uttarardha? Three. Write down three. Important Charak Chikitsa Sthan. Write down Chikitsa Sthan. That is management or treatment of the disease. Chikitsa is a management. Chikitsa is a treatment. Sthana is a particular section of that Charaka Samhita, huge Charak Samhita. First half, Charak Purvardha, you have completed. Charak Uttarardha, now you are studying. Three sthanas. Chikitsa Sthan, maximum marks, 60 marks out of 100. Maximum marks, Chikitsa Sthan. Why? Why? You write down important phrase of the Ayurveda. Charakastu Chikitsite. Write down. Charakastu Chikitsite. Some words you must practice also writing in Marathi, please. Marathi, Devanagari script. Maybe Sanskrit or maybe Marathi. Devanagari script. Your father and you were asking me, sir, in English paper, whether it is necessary, whether it is essential. So I think there is internet connection problem with the student. He may be joining little again. Yes. Yes. I think Ankit, you have the problem of the internet. So sometimes you are going offline and again you are joining. Anyway, no problem. I will repeat the things. Okay. So I was talking that in notebook you write down Charakastu Chikitsite, Charaka Grantha, Charaka Compendium. This is the word, English, compendium. Samhita. Write down in Marathi, Samhita. Charaka Samhita. Why it is important? Charakastu Chikitsite. Some words I was talking that your father and you were asking me in the English medium students whether they are expected to write some words in the Devanagari. Yes, that will be better. That is not compulsory, but yes, you will get benefited. You will get benefited. If you write some words in Devanagari, then he will understand, oh, he knows Ayurvedic terminology also. So Charak Grantha, Charaka Samhita is important because it gives you the basic principles of treating any disease. Treating any disease. That's why it is important, because there is a criticism. There is a criticism from modern science. Oh, this is 5,000 years back. How you can use this nowadays? So tell them that the principle of management remains the same. And that is why I will give you one or two examples. Why? Because Ayurveda says for treating the Pakshagate Virechanam. This is the principle. For the hemiplegia patient, as there is a problem with the sira, with the snayu, especially the sira, blood vessel problem, thrombosis, embolism, hemorrhage, according to Ayurveda, this is the upadhatu of Rakta. Rakta and the Pitta are the Ashraya-Shri Sambandha. And that is why Ayurveda says, in Pakshaghata patients, after few days, you must try for Virechana Chikitsa to purify the blood, to purify the Pitta. Pakshaghate Virechanam. So, Langhanam Svedanam Kalo. Langhanam Svedanam Kalo. Yavagu Tiktako Rasaha. Malanam Pachanani Sir. Yathavastham Kramenava. Don't take tension. Don't take tension. These all shlokas will come step by step. And you can hear my all the time videos and audios all the time. Oh, Langanam, write down. Langanam, Svedanam, Kalo, Yavagu, Tiktako, Rasaha, Malanam, Pachanani, Syuhu, Yathavastena Kramenava. This is the Chikitsa Sutra of Jwar Vyadhi. Jwar, fever. Fever, F-E-V-E-R, Jwar, pyrexia. So these type of lot of formulas, lot of siddhant, lot of principles are given by Charaka Samhita. That's why Charaka Samhita is important if anybody wants to master in Ayurvedic treatment. Sushrut. Who is Sushrut? Yes, Sushrut is related with surgery. Shalya Tantra. Sushrut is called as father of surgery. Father of surgery. So for surgical students, surgical branch, Sushrut is more important. It doesn't mean, this way ki Sushrut is not important for Chikitsa. No, he is important. But primarily for Kaya Chikitsa, for internal medicine, Charak is important. Sushrut is secondary. For Shalya Tantra, Sushrut is primary. Charak is secondary. Are you getting the difference? Yes. So Charakastu, have you written down? Chikitsite. Chikitsite. Charakastu Chikitsite. Say 100 times. And learn by heart. Dr. Deshpande always telling which should be learned by heart. Some words, some keywords, some phrases, some understanding. बिल्कुल पक्का करना चाहिए. कोई भी टीचर आपके सामने डिस्कशन आ गए तो बोल देना चरकस्तु चिकित्सिते. Charak is the best text to treat the patient because it gives. Many people say, sir, the Charaka, whatever the Charak has given some medicines, they are not available in the market. How you can treat? Tell them that those particular things are not important. We have a lot of further medicines. Rasaushadhis are there. All the different medicines are also there. Herbs are there. That is not. But how to treat it? In the beginning, the principle is more important. That some different formulations, even the Himalaya company has developed the formulation. But what is the base? Dabur company developed lot of medicines. Charak is a name of company also, pharmaceutical company, Charak. They have developed lot of Ayurvedic medicines. But what is the base? Charaka Samhita is the base. And you have to convince in that way. Okay. So there is a Chikitsa Sthan. There is a Kalpa Sthana. Please write down these 3 words. Chikitsa Sthan. Kalpa Sthan. Kalpa Siddhi Sthan. And whichever the book that you have, Charak Samhita, you read the index immediately after my lecture. Whole index, which are the chapters of 30 chapters of Charaka Samhita. After these question papers, I am going to read also the different names of the chapters. Reading the chapters' names and carefully keeping it here, learn by heart, path karun takaisa. I don't know the Hindi word for pathantar, but magap. These understanding, remembering the names of the chapters even is a 50% study. Yes, take it from me. Yes, it will give you a lot of confidence. Okay, so read Rasayana Sevana Se Labh. First question. Rasayan is the first chapter of Chikitsa Sthan. So you write down Chikitsa Sthan, Rasayan, important. Then Navananasya Upadrav. Sorry, I forgot to tell you the third sthana. Chikitsa Sthan, Kalpa Sthan, and Siddhi Sthan. I am sorry. Charaka Chikitsa Sthan in the Uttarardha. Kalpa Sthan. What is the Kalpa Sthan? The different herbs, different medicinal plants are mentioned which are useful for Panchakarma, 5 purificatory processes. detoxification of the body. Vamana, therapeutic vomiting. Therapeutic vomiting for Kaphaj predominant Vyadhi. Vamana. Virechana, that is purgation, therapeutic purgation, therapeutic laxatives to make our stools normal or little bit loose motions, to clear, to shodhana of pitta dosha. Vamana, virechana, virechan for pitta, vaman for kapha. Third panchakarma, yes, basti. Basti, medicated enemata. Medicated enema. Important two types. Basti, important two types. Anuvasana, anuvasana. And second, asthapana. Anuvasana, asthapana. Anuvasana means, write down, oil enema. Only oil is there. Anuvasana. Asthapana, there is another word, write down. Niruha. Asthapan means niruha. Asthapan is equal to niruha. And in niruha, there is, in addition to the oil, in addition to oil plus decoction, vath, plus kalka, paste of the herbs. So anuvasan, only oil. Asthapana, second name is niruha basti, oil plus decoction, vath, plus kalka paste. So we have talked about vamana, virechana, basti. Basti for vata dosh. Vaman, kapha. Virechan, pitta. Basti, vat. Then rakta mokshana for blood. Rakta dhatu. Rakta dhatu for purification. Rakta mokshana, in English, blood letting. To take out the blood. Like we do the blood donation. Rakta mokshana. Fifth, panchakarma, nasya. Nasya, putting any medicine through the nose, nasal drops. For what? Panchakarma, nasya, urdhva jatrugata vyadhi. Jatru means clavicle. Urdhva jatrugata vyadhi, above clavicle, whole of this problem, brain problem, eyes problem, ear problem, nose problem, mouth problem, anything. Nasya, best treatment. It is not related with only vata, pitta, kapha, dhatu. It is related with sthan, organ. Okay. So medicines required for this panchakarma are given in which sthan? Which kalpa? Write down, kalpa sthan. What is siddhi? Siddhi sthana, last siddhi sthana is more important. Siddhi sthana talks about details of panchakarma. Yes, details of panchakarma, especially indications, contraindications, complications, where to give woman, when to give, when not to give, contraindication. If given, what are the side effects? What are the complications? So all details of panchakarma discussed in which siddhisthan. Okay. So Charak Uttarardha is made up of Chikitsasthan, Kalpasthan, and Siddhisthan. So this question, Navanasya, now you firstly take into mind which little bit sthana is related with this question. So Nasya means Siddhisthan. Next. Shukra Kshaya Hetu, Chikitsasthan. Visarpa is a disease. Dosha Dushya. You know what is Dushya? Please write down, Ankit. Dushya. First is dosh and then dushya. When our faulty food, not eating properly, our lifestyle is faulty, then dosha prakupita. Dosha prakupita. And yes, I am reading your chat, no problem. Disease. Okay. Which disease I don't understand. Visarpa. Visarpa is the name of the disease. Yes. I will answer. No worry. No problem. No issues. Even at the end, even I will check whether there is any chat. Visarpa is like erysipelas. You can write down. It's like a blood problem. Write down erysipelas. ERYSE. Cephalus. PALES. Erysipelas is like a bloody patch on the skin. Viscerapa. Erysipelas. Now I have made a trick to you in the morning. Google Guru little bit. So the modern term, especially erysipelas, immediately after my lecture, Google search, what is erysipelas? You will get the idea. Then you will get a confidence. Yes, I know Viscerapa. Okay, but basically, Ayurvedic concept, you first try to explain in Ayurveda, and then compare for comparison, you can make also modern, no problem. Dosha and Dusha, I was talking about Dusha. Here, doshas are get prakupit, and then they attack on any dhatu. Rasa dhatu, rakta dhatu, mausa, med, asti, attack. Dhatu. Or sometimes mala, mutra, purish, sweda. So they attack either of the dhatu or either of the mala. So the elements on which doshas are making attack, they are called as dusha. Don't forget this word, dosha and dusha. Whenever there is rakta asar, rakta hina sar, then that pitta dosha will attack on the rakta dhatu, which is weak, WEAK. कमकुवत है वो, तो उसके ऊपर हमला बोल देगी पित्त दोष, तो क्या बन जाएगा? विसर्प व्याधि बन जाएगा. So दोष दुष्य संग्रह. There is a title, your internet connection is unstable. Sometimes it can happen. Or India, we are living in India, so this can happen. Okay. Next, Sam Nirama Jvara. Jvara is a fever. So it is a question of Chikitsasthan. Sudha, Paryay, and Kalpa. So this may be the question from, because this is a particular product, Kalpasthan. You write down Sudha, Kalpasthan. You look index afterwards. Achara Rasayan, first chapter of the Chikitsasthan. First chapter, first is Rasayan, then there is a Vajikarana. Rasayan is a tonic, Vajikarana is a sexual tonic, sex tonic. Vajikarana. Vaji is like a horse. Vaji is a horse. Horsepower. That is sexual. Vajikarana. Second chapter of the Chikitsasthan. Mrudha Bhakshanajanya Pandu. Mrudha. I think all the terms will come in the Roga Nidana. Remember, every Charak term they are all coming here and there. Sometimes it will come in the Swastha Vritta. Sometimes it will come also in the Stri Roga Prasuti Tantra. Sometimes it will come into the pediatrics, Kaumar. In Kaumar Vritta, we have seen this word. You remember? Pandu. Pandu is anemia. Less hemoglobin. Less RBC. And Mrud Bhakshanajanya. Mud eating. Sometimes the the small children, they eat because of the calcium and iron deficiency. Do you remember the Mrudha Bhakshanajanya Pandu, Mrudha Bhakshanajanya mud eating anemia? I have given you one term. That is why I am saying always I revise. You write down, please write down. Paika. Pica. Paika. Mrudha Bhakshanajanya Pandu. Yes, thank you very much. You remember. Thank you. Thanks a lot. I admire your response. Next. So this is a Pandu. Whenever disease come, whenever any disease, you have to make a short list. Pandu, Chikitsasthan. So Chikitsasthan, Pandu is important. Jvara is important. Okay. Then Vrishya Ghrita. Ghrita, Vrishya means again aphrodisiac, increasing your sexual power. So that is a question of Chikitsasthan, Vajikaran chapter. You must remember which sthana, which chapter this question has been asked. Raktatisara. Rakta and Atisara. Atisara, loose motions. Gudena. Bahudravasaranam Atisaraha. Per rectal, lot of water is going. Atisara. Okay. And Raktatisara with blood. Bacterial diarrhea. Okay. So Hetu means causes. Hetu means causes. Chikitsa is a management. Then Shwas, this will be the questions of Chikitsasthan. Shwas is breathlessness. Shwas, breathlessness. Like there is one type, Tamakashwas. Tamakashwas, bronchial asthma. Question from Chikitsasthan. Samanya Samprapti. Write down this word. Samprapti is a pathogenesis. How the disease is taking place. After the causes, what is a Shat Kriyakal, Chaya, Prakop, Prasar, Sthana Samshre, Vyakti, and Bhed. How the disease has spread and full bloom. That is called as a Samprapti. This Samprapti word is very important in Monday's lecture. Roga Nidana and Vikriti Vijnana. Write down Nidana Panchak. Nidana Panchak. Write down Panchak. 5 things about the Roga Vijnana. I am telling you right now. 5 things you write down. First, Nidana. Oh, sir, Nidana Panchak, you saying first word Nidan? Yes. Nidana is equal to Hetu. Nidana is equal to Hetu. Causes. Etiology. 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 So this is the first thing. Nidana. Purvarupa. Warning signals. Warning. Prodromal symptoms. Prodromal. Prodromal symptoms. Purva Rupa. Nidan Purva Rupa. Rup. Third. Rupa. Signs and symptoms. Rupa. Signs and symptoms. So Nidan causes, Purva Rupa prodromal symptoms, Rupa, Upashaya and Samprapti. Upashaya means therapeutic measures to decide, to make a confirmation diagnosis. Whether the patient is feeling better after treatment with particular things or is not feeling good, that is called Upashaya, Anupashaya together. Upashaya, feeling better with your some tricks and not feeling better. But I will discuss in Monday also. Roga Nidana Vikriti Vijnana. Upashaya, Anupashaya, and last is a Samprapti, pathogenesis. Okay. Madatya, drunk, alcohol, Madatya, lot of drinking of alcohol, alcohol intoxication. As you are from the English medium, remember some terms allopathic. Alcohol intoxication, Madatya. Chikitsasthana, yes, Chikitsasthana. Shvitra Kushta, Chikitsasthana. In the morning also, I think discussed about Pua therapy. Do you remember Pua? Sorelin. Actually, the word, you may be confused, sir. You said Sorelin, then spelling is SO, and you are talking Pua P. Here in the Sorelin tablet, P is silent. P word is silent, is not mentioned. So Sorelin is Psoralin for the leukoderma. Shvitra is a leukoderma. Sitting in the sun. We have discussed in the morning. Sattvarutta. Okay. Kalpasthana Prayojana. Kalpasthana, where the drugs are given, medicines, herbs are given. Madanaphala is the best medicine for Vamana. So they are asked Madanaphala Paryaya, synonyms, Guna, properties, Sangraha Vidhi, how it should be collected, and Kalpa, different formulations. Write down. Kalpa. What is Kalpa? What is Kalpa? Write down. Formulations. FORMULA. Yeah, different formulation, different recipes, different products. I have mentioned 3 words for Kalpasthana. Products, recipes. So Kalpa, different formulations. Next, Urustamba Vyadhi. Again Vyadhi. What is the sthan? Chikitsa sthan. Urustamba. Urustamba is nothing but the stiffness of the thigh. Please write down. Stiffness of the thigh muscle. Thigh. You know the thigh. Stiffness of the thigh. Nidana Panchak. Just now I have said Nidana Panchak. Nidana, Puru Rupa, Upashay, and Samprapti. Nidana, Puru Rupa, Upashaya, Anupashaya. This is called as a Nidan Panchak. Never forget this term. Very important term. Nidan Panchak and Chikitsa. Total management. Basti Vyapat Siddhi Adhyayanusar. So naturally, this question, Panchakarma question, from the Siddhisthana, because they have discussed lot of Vyapat. Please write down the word Vyapat. Here it is, you can see here, Basti Vyapat is equal to complication. Vyapat is a complication. Vyapat is a, yes, please write down complication. Have you seen Niruha Basti? Just now I have explained Anuvasana and Niruha. What is the another name for Niruha? Please write down. Niruha, Asthapana. Asthapan is equal to Niruha. What is the difference? In Anuvasan, only oil. Little bit salt, namak, sandhav. But in Asthapana, oil is there, plus decoction. What is decoction? Quath plus paste, herbal paste. What is that? Ayurvedic word? Kalka. You must remember these Ayurvedic terms also. Huh? Okay. Kasa vyadhi, important. Kasa is cough. Vataja, pittaja, kapha. Shataja, kshayaja. Kasa is a cough. So Nidana. Nidan means? Actually, you should write down. There are interesting things. Two meaning of Nidan. दो अर्थ है निदान के, two meanings. One is a causes. निदान का एक मतलब होता है cause, कारण, और दूसरा मतलब होता है diagnosis. Write down, diagnosis. My diagnosis, this patient is having typhoid. This is diagnosis. And what is the cause? Contamination, drinking contaminated water. And the cause, Nidan has two meanings. Nidan word has two meanings. One is a hetu, and second, hetu means cause, and second is a diagnosis. Are you getting my point? So when we talk Nidana Panchak, which meaning you should take? Not diagnosis. Hetu, Purva Rupa, Rupa, Upashe, Anupashe, and Samprapti. Okay? Next. 2021 paper, come on. Siddhisthana Nirukti. Siddhi means success. If I do my Panchakarma best treatment to the patient, I will get success in my practice. So Siddhisthana Nirukti. How that particular word has come? Nirukti. You know, Tapasantape, Nirukti of Pitta. Shlisha Alingane, Nirukti of Kapha. Next. Vatarakta Vyadhi. Again Vyadhi. What is which sthana? Yes, Chikitsa sthana. Vatarakta Vyadhi is a joint pain. Huh? There is a dosh is Vata. And Dusha, what is the Dusha? Yes, Rakta is a Dusha. Because Prakupita Vat has attacked on the Rakta. Now, Vatarakta is compared by some Vaidyas. By some Vaidya, it is compared with the gout. Please write down. G-O-U-T. Gout. That is the inflammation of the toe. T-O-E, toe. पैर के जो अंगूठा होता है ना, उसको सूजन आ जाती है. गाउट बोलते हैं. यूरिक एसिड प्रॉब्लम है. यूरिक एसिड. ये एक मतलब हो गया. और कई वैद्य, थोड़ा सा है वैद्य, उनका परसेंटेज कम है, कई बार उसकी तुलना रूमेटॉइड आर्थराइटिस के साथ वातरक्त is also compared. Basically, it is compared with the gout. But second, it is also compared with the RA, rheumatoid arthritis. RHEUMATOID, rheumatoid arthritis. Okay. So anyway, वातरक्त व्याधि प्रकारानुसार लक्षण etc. चिकित्सा स्थान. भल्लातक दहा रसायन योग. Although Bhallatak plant, you may be thinking, sir, Kalpastan? No. Why? Because you can see Rasayana Yoga. Rasayan. So Rasayan is a chapter, Chikitsastan, first chapter Rasayan, second chapter Vajikaran. So this is from the Rasayan chapter. Punaravartak Jwar, recurrent fever. परत बार बार आने वाला बुखार जो है, पुनरावर्तक. From the Chikitsastan, Shakashrit Kamala, write down. जॉन्डिस, JAUNDICE, जॉन्डिस. पीलिया रोग बोलते हैं ना हिंदी में, जॉन्डिस. और साइंटिफिक नेम क्या है उसका? व्हाट इज द साइंटिफिक नेम? इन्फेक्टिव हिपेटाइटिस. क्या लिखेंगे? इन्फेक्टिव. वायरस, वायरस ए, वायरस बी, वायरस सी, वायरस डी. jaundice के लिए, because of the jaundice. Yellow discoloration of the conjunctiva, yellow discoloration of the nail, yellow urine. Jaundice, how you diagnose? How you diagnose? Now you are going with the any hospital and doctor, you tell your knowledge to him also, he will happy. Jaundice, how to diagnose? Urine test, very cheap urine test, not cheap, it is also costing 200 rupees. Urine, bile salt, bile pigment, jaundice. And blood test, what is blood test? Bilirubin. What you have to check? Bilirubin. Okay, so this is the chikitsasan. Vatsaka paryay. Paryay means synonyms, different names. And kalpa, formulations, products. So this is the from the kalpasthan. Okay, next. Tikshna, madhya, mrudu, vaman, and virechan. So tikshna vamana, madhya vamana, mrudu vamana. Vamana is a therapeutic vomiting. Also, tikshna virechana, madhya virechana, mrudu virechana. Mrudu virechana means laxative, and tikshna is a purgative, danti. Okay, so this is from the siddhisthana. Nirupastambhit vata vyadhi. Vata vyadhi, very important topic. Vata, musculoskeletal problems and neurological problems. Vata vyadhi. Musculoskeletal means muscles and bones, ligaments, tendons, and neurological, nervous system problem. Basically, vata vyadhi are of two types. Upastambhit, write down, please write down. Upastambhit vata vyadhi is equal to obstructive. There is obstruction to the flow of vata. Vata energy is moving, obstruction. Obstruction. Upastambhita obstruction. Nirupastambhita, no obstruction, but vata vyadhi, another cause, you write down. 3 times I will say. Dhatu kshaya janya vata prakop. Dhatu kshaya janya vata prakop. First, what is upastambhit? Another word you write down. Upastambhit is equal to margavarodha janya. Margavarodha janya. Marga, avarodh. Margavarodha janya. That is upastambhit. Obstruction pathology. Obstruction. Next, nirupastambhit. Nirupastambhit. Here word is there. That is equal to dhatu kshaya janya. Kshaya means TB. No. Dhatu kshaya janya means deficiency disorders. Deficiency disorders. Vata problem. So vata problems always two pathogenesis. Two. Upastambhit, nirupastambhit. Upastambhit, nirupastambhit. Obstruction, margavarodh, dhatu kshaya deficiency, protein deficiency, carbohydrate deficiency, fat deficiency, vitamin deficiency, mineral deficiency, rasadhatu kshaya, raktadhatu kshaya. Kshaya means deficiency. Ayurveda, kshaya is not TB. Here. Next, aruchi. टेस्ट नहीं है, खाने को टेस्ट नहीं है, अरुचि. एनोरेक्सिया, राइट डाउन, ANOREXI, एनोरेक्सिया. टाइप्स, प्रकार मीन्स टाइप्स. एंड चिकित्सा सूत्र, वेरी इंपॉर्टेंट प्रिंसिपल. नाउ, अल्पस्यापि महार्थत्वम प्रभुतम स्थ अल्पकर्मताम. Actually, this is the specific quote from the Charak. I have also to refer, and I will tell you what is that alpasyapi mahartatvam prabhutasya alpakarmatam. This is a management principle. How this can happen, and explain the sneha pak. Sneha pak. When we prepare any oil, that is called as a taila kalpana or the ghruta kalpana. Taila kalpana, preparation of medicated oil. Ghruta kalpana, preparation of medicated ghee. Okay, औषधि तेल and औषधि घृत आपको बनाना है, तो उसके स्नेह पाक बनाते हैं. जब make what you can say the cooking, there is a different types of stages in that cooking process. Maybe this can be the part of Kalpasthan or Siddhisthan. I will have to refer. Then next is a dhvamsak and vikshaya vyadhi, specific type of the vyadhis that I will discuss afterward. Dhvamsak and vikshaya, lakshana, symptoms and chikitsa. Kshatakshirna vyadhi, it's like related with Rajyakshma type of the chapter. Chikitsa, Chatakshirna. Chata is a trauma, cavity, and kshirna means weight loss. Niruha basti vyapad, I have explained to you, vyapad is a complication. Siddhisthan, okay. Gulma vyadhi, chikitsastan. Gulma is like a tumor. Gulma means tumor. Samprapti, pathogenesis, prakar, types, and chikitsa sutra, there's management principle. 2021, okay. Siddhisthan and Nirukti, I think the same question. Vatarakta, I have explained a lot. Bhallatak, I think this is a, sorry, maybe repetition, because it is a, unfortunately, same paper is there. Okay, sorry. Maybe some differences are there. Ruchi, we have discussed. Now I will see. Gulma Vyadhi, okay. Sarvesham bruhanhi alpa, shakyascha prayasho bhavet, natyartham shamani upayo, bhusho ashakyascha karshane. Where this particular principle has been come, especially this is very important for the breathlessness patient, tamakashwas patient. They said that always there should be little bit bruhan, nourishment should be then, and then you can follow that person, removing of the excessive attachment of the kapha. But that we will discuss about when we discuss about hikka, hiccup, hiccup. हिचकी बोलते हैं ना हिंदी में, that is hiccup. And श्वास is a breathlessness problem, dyspnea. चिकित्सा सविस्तर पूछा है, write down the detailed management. अष्टौ महादोषकर भाव, अष्टौ महादोषकर भाव, you can make a question mark, we will discuss afterwards. देश काल प्रमाणानाम सात्म्या सात्म्यश्च एवहि सम्यक योगस्था हि येषाम पथ्यम अपि अन्यथा भवेत्. That also you can make a question mark. We will try to find out the exact reference and then we will discuss. Okay, we will go further. This is 2020 paper. Kuti praveshik rasayan. Kuti rasayan. This is two types of rasayan. Please write down this word. Kuti praveshik. Kuti is like house. In-house management. In-house management for the rasayan treatment, for giving the anti-aging management. Budha nahi hona hai mere ko, budha nahi. I don't want to be an old person. Then I have to enter into the specific spa hospital where this rasayan treatment is given. So kuti is like in-house management. And another type of the rasayan, please write down another type of the rasayan, vata tapik. Vata tapik. Vata पीक, वातातपिक. जैसे भी लिखने आता है लिख दो वातातपिक. वात इज अ विंड, आतप सूर्य सन. वातातपिक rasayan. So you can take the Chyawanprash, which is available in the market, not going into any spa, not going into any hospital, not going into the kuti, no in-house management. You can do your regular job. You are going to the college, you are going to the business, you are going to the service, and take only Chyawanprash. That is, what is that? Vatatapik rasayan. Vatatapik rasayan. Two types of the rasayan. Kuti praveshik, vatatapik. Don't forget. Jwara vyadhi, langana mahatva. Langana is the fasting. I have already explained you the formula. Langanam swedanam kalo. Yavagustiktako rasaha malanam pachanani syuhu yatha avastha kramenava. This is a very interesting formula management of Jwara Vyadhi, bukhar, fever, pyrexia. Next, Shwas Vyadhi, again 5 types: Vataja, Pittaja, Kafaja, etc. Shwas Vyadhi, Chataja, Kshayaja, etc. We will discuss that. from the Chikitsasthana. Aragvada Paryay, Bhava. Aragvada is a Bhava. Plant. Paryay synonyms. And Yoga Sankhya formulations. How many products? Which sthan? Kalpasthan. Yes, Kalpasthan. This is the best laxative. Please write down. Aragvada, in your practice, you must give it for the patient to whom you want to give the laxative treatment. पित्त दोष को हमें कम करना है, हीट कम करनी है बॉडी की, आरगवध देना उसको. बाजार में ना यू गेट आरगवधारिष्ट. प्लीज राइट डाउन आरगवधारिष्ट. आरगवधारिष्ट लिक्विड 200 ml prescribed. Basti dosh, that whatever you give the enema, you have to separate yantra, basti yantra, basti netra. I think, I don't know, but in the Vagbhat Ashtanga Hruday, your batch may be 15 chapters only, but in Ashtanga Hruday Sutrasthan, from 16 chapter to 30 chapter related with Panchakarma, the same. Apatyakara swaras. Apatya means child. If you want to get child, that means any person wants to get the child, then he must, for the treatment of infertility, वंध्यत्व के लिए, अपत्यकर स्वरस, ये जूस पीने से बच्चा हो जाएगा आपको. कहां बताया चरक ने? वाजीकरण अध्याय में. वाजीकरण लिख दो आप, वाजीकरण. देन मृत भक्षण जन्य पांडु, पायका एनीमिया. नॉर्मल hemoglobin 12 to 14 gram%. Normal RBC count, red blood cell 4.5 to 5.5. Write down 4.5 to 5.5 millions per cubic mm. ये सब आ जाएगा ये रोग निदान विकृति विज्ञान में. This will also come. Okay. सिद्धि स्थान महत्व. सिद्धि means पंचकर्मा description. जिमुतक कल्प formulations, पर्याय गुण प्रयोग विधि. This is in the kalpasthan. Jalodar, ascites, fluid in the peritoneal cavity, ascites. Jalodar. The original vyadhi is Udar. Yes, this is the name of the disease. But Udar is a name of organ also. Udar, that is abdomen, that is organ. But when I say vyadhi, Udara vyadhi, the same name, that is ascites, ASCITES. Okay? Yes, I remember. In the Roga Vijnana, Vikruti Vijnana, in Charak, anywhere, you are asked how you will examine the ascites patient, how you will examine Pakshaghat paralysis patient, how you will examine respiratory system for bronchial asthma. This is called as a clinical examination methods. Professor Dr. Rajendra Deshpande has mobile app. There this program is available. Clinical examination program, only 300-400 rupees for lifelong. There you will get all these videos, very interesting videos. How to examine respiratory system, how to do the pulse examination, how to do the cardiovascular system examination, how to do the per vaginal examination, gynecological, how you can do the child examination after birth. All videos are there. Please download my app, purchase that program and see those videos, make the notes, and you will get good marks in the Roga Nidan Vikruti Vijnana. Clinical examination, best app program, best. You also suggest your friends. ECG interpretation, best program, only 200-300 rupees, only lifelong. Dr. Deshpande has explained how to read ECG, electrocardiogram. Please ask your friends. Also, please ask your friends to join our classes. These all classes, your friends, you request them. Please join. A lot of students should get benefited. Next, we will go further. Grahani. What is Grahani? Grahani is the name of the disease. Grahani is the name of the organ. Please write down Grahani. Grahani is compared with the small intestine. And Grahani, when there is a chronic inflammation, chronic malfunctioning of the small intestine, the Vyadhi is called as a Grahani. Okay, grahani. Organ is there and also disease is there. Name of the organ and name of the disease are same in udara, in grahani. So this combination, organ name and the disease name same, they are difficult to cure. They are difficult to cure. Don't forget, difficult to cure. Shoth is edema. The different types, and Kaunsa Haritaki is a product, is a kalpa. You have to describe that Kauns Harit. What is Kauns Haritaki? Pandu and Kamala. Pandu is anemia, Kamala is a jaundice, infective hepatitis, Lakshana, symptoms, clinical features. What is the difference in symptoms and sign? What is the difference in symptom and sign? Write down. Symptom, Rugna, Samvedya, Lakshana. Rugna, patient, Samvedya, Lakshana, that is symptom. Whatever the patient will tell you, that is symptom. And then you examine, you are doctor, you will examine. And whatever your findings are called as sign, S-I-G-N. Symptom, Rugna Samvedya Lakshana. Sign, Vaidya Samvedya Lakshana. Whichever understood by the doctor. One simple example, simple. Patient comes to you in the clinic. Doctor, doctor, दर्द हो रहा है, इधर दर्द हो रहा है, दुखता है, पोटा दुखता है, दर्द हो रहा है, उधर शूल, pain in abdomen. What is that? Symptom, udara shul, pain in abdomen, symptom. Because patient is telling you. What you will do? Tension mat lena, मैं हूं ना, आप लेट जाइए इधर, लेट जाइए. You will ask him to lie down on your examination table. And then you will first palpate the liver. And when you are pressing on the liver area, right side of below the ribs, you are pressing and you are examining the abdomen. When you are pressed, patient, this is tenderness. Please write down. Tenderness. T-E-N-D-E-R-N-E-S-S. Tenderness. In Marathi, sparsha sahatva. Sparsha sahatva. Sparsha asahatva. He cannot tolerate your touch. This is sign. Pain in abdomen, symptom. Tenderness is a sign. Very clear. Whichever the things that you learn in Professor Deshpande's class, you discuss with your friends. You discuss with your favorite teachers. You discuss with your doctor, which you go to on Saturday. Tell him what you have learned in the week. He will be happy. Good. Come on, go like that. So always tell something to your friends, to your father, to your family members, to the doctors, to the teacher. This will make you more confident. सिर्फ सुनना नहीं, यहां से ऐसे बैठकर सुनना नहीं है, सिर्फ आपको मुंह से बोलना है. Ankit, this is my observation. You try to speak a lot to everybody regarding the medical knowledge, regarding these subjects, 5 subjects. Then you will be more confident and you will get more marks in the theory as well as in the practical. So make a habit of speaking. You are always asking you and your father, what should be done? First suggestion I have given by the mail. Your handwriting, okay, this is altogether, we cannot change our handwriting, but is little bit more slanting. So if possible, in this coming 6 months, you try to make it more vertical. All the words, try to make it vertical. Because all slanting, sometimes some examiner may be not happy with that particular style. So this is a kind request, but don't take a stress. Don't take stress. Immediately we cannot change our own handwriting. Other things are perfectly all right. You are studying hard, you are very sincere, you are very giving respect to the teachers and the doctors. That is fine. Your study is, you are doing your level best. I am admiring all these things. But I am also a good teacher. So I must give some suggestions also during the these things. Okay, we will go further. As the time is going up, only we will finish this paper and you have to write down till which paper we have come across. Because Dr. Deshpande is not only reading, he is discussing, he is telling you by comments, and that is very useful. Okay. Rakta Pitta Vyadhi. Interesting. Rakta Pitta. Write down. Rakta Pitta. Now you tell me, what is the dosha? Name is there. Pitta dosha is there. What are the properties of Pitta dosha? Pittam sasneha tikshnashnam lagu visram saram dravam. These properties of the first year BMS, you should never forget till end of your life. Properties of Vata, properties of Pitta, properties of Kapha, revise them 100 times. What are the properties of Vata dosha? Tatra ruksho lagushchitaha kharasukshmaschalo nilaha. Pitta, pittam sasneha tikshnashnam lagu visram saram dravam. What are the properties of Kapha dosha? Snigdha shito gururmandaha shlakshna sandra brudasthiraha. So these properties, Samanya Vishesh Siddhanta, then it is very easy to write down Charak, very easy to write down the Roganidan Vikriti Vijnan, very easy to write down the Swasthavritta diseases, very easy to write down the Balaroga, very easy to write down the Prasiti Tantra and Stri Roga. Yes, any disease, if you know the basic things, it is very easy, very easy. So here Rakta Pitta, Pitta dosha is a Vikrita dosha, and Rakta is a Dusha. Rakta Pitta, nothing but the bleeding disorders. Bleeding disorders. खून की जांच करते हैं ना हम, शारीरिक व्यायाम में सीखे थे, BTCT, bleeding time, clotting time. So these patients have the problem with the bleeding time, clotting time, which is more. Platelets problem may be there. So this patient may suffer from the bleeding from nose. Bleeding from nose, epistaxis. Epistaxis, EPISTAXIS, epistaxis. Bleeding from tuberculosis patient. From the sputum, bleeding from sputum. Rakta Pitta, hemoptysis, HAEMO. HAEMOPTYSS, hemoptysis. Bleeding from the rectum, per rectal bleeding. Bleeding from urine, hematuria. All this is Rakta Pitta. Then you have to describe the types: Samprapti, pathogenesis, Sadhya, Sadhyatva, prognosis. Please write down. PROGNOSS, prognosis, Sadhya, Sadhyatva. Whether it is curable, incurable. Ashto Mahadoshakar Bhav, Varnan Karun, त्याची सविस्तर चिकित्सा. तस्मात् पुरुषम संरक्षम विशेषात राजयक्ष्मिणाः. This is related with the tuberculosis, Rajyakshma, tuberculosis. There they said your Purish, the patient should not suffer from the loose motions. You should protect, because it is a vital, the element that will lose again his strength and power, tuberculosis. Saptala Shankhini Paryay. This is from the Kalpasthan. Saptala Shankhini Paryay, Matra, Ekun Yog, formulations, products. Okay. So please write down. We will start reading winter 2020. Winter 2020, we will go further. Okay. Page number 10 out of 28. Page number 10 out of 28. Please write down. Okay. So thank you very much for the nice hearing. We will meet in the next lecture on the Monday. That is the lecture of Roganidan Vikriti Vijnan. You please appeal to your students to join our classes. And I wish best for your studies, and take care and good evening. Thank you very much.